Good afternoon, everyone. Thank you for joining us today. My name is Melanie Paris, and I'm the Senior Director of Health Initiatives and Education here at the American Kidney Fund. Before I turn the presentation over to today's speaker, I'd like to direct your attention to the control panel you should see on your screens. All participants are on mute, so we won't hear you, but we welcome your questions. If you have a question, please type it into the section of your control panel titled Questions. We'll see your questions and we'll do our best to answer them, either by replying to you in the questions box or out loud during the presentation. This webinar is being recorded and will be available for viewing on our website, kidneyfund.org/webinars, within the next 1 to 2 weeks. As a friendly reminder for those of you who are health professionals, this webinar is not accredited for continuing education credits. If you believe that your accrediting body may offer you credits for attending this webinar, we'll be happy to send you a certificate of attendance after today's session. Simply email us at education@kidneyfund.org. Without further ado, allow me to introduce today's speaker, Ms. Jana Collins. Jana Collins is a nurse educator and an Army veteran. She works as a clinical instructor at Delaware Technical Community College. Through teaching, she's found that encouraging nurses to educate their patients in a more effective way can bridge the patient-provider gap. She has a deep appreciation and commitment to her work in the healthcare field that supports and promotes innovative and high-quality patient-centered care. Currently, she is pursuing a doctorate of nursing practice where her focus will remain on healthcare disparities, nurse education, and holistic nursing care. Jana is a leader in the healthcare industry and in the community, and we are so glad to have her here today. Thank you, Jana, for joining us.
Thank you for having me. It is a great pleasure to be here this afternoon, and welcome everyone for being here with me as well. Today, our objectives would be to learn how to communicate better with your providers, and your providers communicate better with you. So a couple of our objectives will be to learn ways you as the patient and the provider can communicate and improve your health for the long term. Develop some steps for you, the patient that can help to improve conversations with healthcare providers, and learn how you can improve and be active members in your healthcare team, because without you, we will not have healthcare. So as we move forward, I want to introduce some of the topics. So patient advocacy is important. Today in healthcare, we find that our patients are not speaking up for what it is that they need or want from us as providers in healthcare. So when I talk about advocacy, I'm talking about being a participant in your healthcare and speaking up for yourself by actively communicating with your providers. There are many disparities of difficulties that patients experience as they navigate through healthcare, because as we all understand, navigating the healthcare system is not easy. These issues become even more complex when we are suffering from chronic illnesses. It is common that most of our patients living with chronic illnesses sometimes have other comorbidities that are the leading cause for them to have kidney failure. Having 2 or more illnesses will consider you to have a comorbidity. So if you're suffering from COPD or chronic pulmonary obstructive disease and have asthma and have hypertension, then you have comorbidities. Some patients feel that their health care sometimes is dictated to them. So by opening the gates of communication, we feel that we can both be on the same page and have a better team moving forward. And this will also help our patients maintain compliance with medications and treatments moving forward. So without further ado, we'll continue. Just a little statistics as we're discussing this, because we have to have some statistics of what's going on. So as we can see, some of our statistics have African Americans are 17.1%, and Mexican Americans are 15.29% more likely to have a chronic kidney disease than our Caucasian counterparts. Patient awareness is less than 10% of those in stage 1 to stage 3, and awareness is higher among our patients with stage 4 kidney disease. This is partly due to the fact that by the time you're in stage 1 to stage 3, you have other comorbidities that lead you to learn more about kidney failure and having to do with moving forward in your healthcare process. Some healthcare disparities that we have that patients are dealing with on a day-to-day basis are navigating the healthcare system, which is number one, because as we all are aware, with the changes of affordable healthcare, it's pages and pages long, and not many of us are reading all those pages to navigate through the system. And we also have different negative groups that are being targeted as well as our LGBTQ community. Sorry if I left out a letter, are part of our healthcare disparities as well. When I speak about healthcare disparities, this refers to a higher burden of illnesses and injury, some disabilities or comorbidities that is experienced in a different population or group. A healthcare disparity typically refers to differences between healthcare groups, insurance coverages, access to healthcare, or quality of care. This includes our patients' preference for treatments and different recommendations, and depending on the area in which they live. Healthcare disparities affect groups of people who have experienced different obstacles in healthcare based on their religion, socioeconomic status, age, mental health, and sexual identity, just to name a few. When we talk about healthcare, we talk about communication. Communication is a big piece because without communication, one hand doesn't know what the other hand is doing, and we all need to be shaking hands and joining hands together to move forward in healthcare. Some emotional barriers that we are facing are common with our patients because once our patients are diagnosed with a chronic illness, we notice that they stop listening to some things that we're saying as providers. So some people or patients may find it difficult to express their emotions on some topics and may find it off limits or taboo even. So we have to bring those conversations back and help patients articulate or speak about what it is that they need from us as providers. That is providers, MD, nurse practitioners, and nurses as well, because we're all part of the healthcare team. Some of our social norms and cultures also get in the way of communication, because depending on what region of the world that we are coming from, we have to approach conversations differently. So we have to take that into consideration as well. Hierarchy in families. If sometimes patients don't want their parents to know what's going on with them, or wives or husbands, so we have to take that into consideration as well. We have some time constraints. As providers, our time is cut short when it comes to dealing with patients, so we have to keep that in mind as well, and welcome our patients to come back and ask questions and email any questions that they may have, or phone in any questions to the nurse or the physician if need be. We have a lack of attention or interest. We get distracted. As we can see with the change in healthcare, a lot of our documentation is done on the computer. So with that, we have a computer in front of us. Our eye contact with our patients is not happening, so our patients feel like that we're not engaged with them, and we have to make sure we keep those lines of communication open. And with that, also, we have to remember that some of our patients have some physical disabilities and some hearing deficits and speech problems as well. So we have to keep that in mind when we're dealing with our patients. So all these things can impact our communication. So these are part of our barriers that we list here. Also, we as providers, we have a large vocabulary. So we use a lot of medical jargon. And we have to remember that a lot of our patients don't know what atelectasis may be. So we have to tell them what it is and explain to them in layman's terms what it is that we are discussing with them, and make sure that they understand and ask if they understand. Along with our disparities, we have some literacy issues as well. Literacy does not limit with age. It does not limit with social class. It has no friends and many enemies, okay? Literacy does have many boundaries. It covers race, gender, social class. Poor literacy can be caused by an array of problems with communication, cognitive issues. Patients can have difficulty processing. They can have problems reading, writing. So we have to bear this in mind. And with that, our patients don't share that with us as providers because they are, I would have to say, they don't want to feel less than. Okay. Patients are intimidated by providers. You have MD behind your name. You know a great deal more than they do. So by that, they stop talking. They don't want to tell you what they know and what they don't know. And they'll sit there and just say, yes, I understand, and won't ask the questions that they need to ask to make sure they understand treatment. But most patients also have adapted to not being able to read or write or understand and process effectively. So we find that they ask the most questions because they don't want you to know that they don't understand. So they'll sit there and monopolize your time to ask you these questions. And this population is not that great, but in numbers, but they do exist, and we have to remember that when we are speaking with our patients and making sure that they understand the treatment plan and medications. So as it seems like we're trying to bring it down so that they maintain compliance in treatment and in medication adherence. Patients with literacy issues are linked to having a poor ability to discuss their pains and ailments. They don't know how to explain to you what's hurting them, how it started, when it started, what if it's radiating, how long it lasts, where did it stem from. So we have to spend a lot of time trying to understand and paying attention where these ailments are starting from, how long, ask the pertinent questions. And having a computer in front of you, it makes that patient not want to communicate any further because they think you're not paying attention, you're not validating their issues, and that you're just want to move on to the next patient. So if we can stop typing on a computer or just write a few notes so that we can go back to the computer if we can. I know today's society that is hard to do, but at least make eye contact with the patient and help them explain what it is that is ailing them at that time. All right, we have to also take into consideration the patient's native language and know that because what we're saying in English can mean something different in their language. So it helps to ask them, can you explain to me what I just said to you, what you took away from that conversation, and explain further if you feel that they have not grasped what you had, what you want to get across. We also have cultural barriers that we deal with on a day-to-day basis as well. Not only is our patients coming from all over the world, so are our providers. And we have to understand that what some providers do in their native home is different from what we do here in the United States. So we have to meet each other in the middle. We have to consider that their accents on both ends for our patients and for our providers. And if you do not understand what your provider is saying or what the patient is saying, ask them, can they repeat it? It sounds tedious, but it's so important to make sure there is clarity before each party has departed from that room, because one misunderstanding on a term or on a direction can mean life or death for that patient. So with language differences, you have difficulty in understanding with unfamiliar accents. We have expectations and prejudices, which may lead to false assumptions and some stereotypes on both the patient's end and the physician's end. We have some we often hear what we expect to hear, but we are not listening to what is actually being said, and then ending up coming to the incorrect conclusions, which is how we come to the patients not taking medications in the correct order or correct directions as prescribed by the physician. Body language is so important. When we look at conversations between our families and friends, we're often engaged either with our hands, our eyes, our whole bodies are affected. So when our physician is sitting there and looking aloof or looking at their cell phone or their pager's just gone off, that makes the patient shut down, and then they decide, okay, I'm done. My doctor's no longer listening to me, and my questions are not going to be answered at this time. So pay attention to your nonverbals. Those are often overlooked by everyone. Your arms are folded, means you're closed off for communication. The tone that we use is very important. Sometimes we don't recognize how we're saying things to our patients or to each other, and it can be misconstrued between the other party as being negative or condescending, and which is not what you meant to get across. Watch how your patients react to you. Patients, watch how your physicians are reacting to what you're saying. So when your patient is telling you how they feel and you roll your eyes, or the nurse says, oh, you'll be fine, that's off-putting to a patient, and that makes them feel unwelcome. So we have to be mindful of how we come across as providers to our patients, and how our patients come across to us as well. So we want our providers to listen to us. We need to listen to them and give them that same respect, and communicate openly and honestly with each other. Otherwise, we're going to have a break in communication and a break in a healthcare treatment plan, and there isn't going to be any adherence on either side, and then we're going to be back to square one again. A great tip that I have for helping to quickly connect with a patient with body language is just to reach out and touch their shoulder and say, I understand what you're saying, or a handshake, or any simple gesture to let them know that you're fully engaged with them is priceless, because that a weight will be lifted and they will be more apt to open up to you and to actively communicate what's really going on with them. Effective communication. We all would like to have effective communication, not just with our patients, but also in our work environment. It all comes from active listening, again, our nonverbal communication, asking those questions, being clear, and clarify and summarize any information that we may have. So how do you have effective communication? We generally focus on what we want to say, but not on what we should say. We know what we want to say, we rehearse it over and over again, and then what actually comes out is not what we intended. So we have to be mindful of how we say things to each other and to our patients. Be aware of your nonverbals. Again, when you speak, keep an even tone, all right? Try not to come across too overbearing as a parent. Okay, parental voice is very important to keep out of talking with your patients. we find that sometimes we fall back into that, especially with our elderly patients. We want to always coddle them, and that's not what we want to do, because again, they're adults and they expect to be treated as such, and to be pacified as such is not fair to them. We want to always speak clear and on what we want to get across, clarify anything that is of medical jargon to make sure that the patient understands. We want to teach back, have our patients teach back what it is that they have taken away from our conversation, so that we can make sure that they can demonstrate it back to us, especially with patients with diabetes. If you're going to go home and you're going to give yourself insulin injections, you're going to teach it back and make sure we can answer any questions, make sure you get your technique correct, and make sure you can clarify anything that's outstanding that you may have before leaving the office. Because what we do not want you to do is cause further injury to yourself. I have here one of my patients. Love her dearly. Jana is not her name, but I did call her Jana. And she was nice enough to share with me her experience being a patient in a new office after being diagnosed with polycystic kidney disease. This has been after years of going into the office and having kidney stones and different things going on, frequent UTIs. So Gina says here, she stated she felt defeated. I felt defeated when speaking with my nephrologist. He told me I had this disease and gave me a list of things to look out for and what I should expect. But all I heard from him at this point was, I can lose kidney function. It's easy to feel defeated at some point when you get a disease, a diagnosis of any sort, okay? And it could be from being hypertensive to having kidney failure. No matter how big or how small, being told that a part of you is not going to function to its normal level is devastating. So I can see how she felt defeated, having been diagnosed with polycystic kidney disease. But all she heard was that her kidneys were going to fail her at some point. There is no great deal of information that is given during an initial visit for her. She's given all this information, pamphlet upon pamphlet, about what to expect, when to call the physician, what her treatment plans, options are, but not at one time did she ask a question to her physician. I asked her, did you ask the doctor what is to happen? You know, did you have questions for him? Did you prepare any questions prior to the visit? Did you look up any information about polycystic kidney disease? Did you look up what kidney failure actually entails? Was your physician engaging? Did he ask you if you had any questions? These are all things that, as a patient, I will want to know. And Gina just looked at me and said, well, maybe, I don't know. So the next thing I asked her, I said, well, what do you recall, right? So you repeat it, you rewrite it down, what it is that you recall from the visit. You make notes on what was clear and unclear to you. You consider what you think you know about health, what you know about your own health, how well you are, what led up to the frequent UTIs, what you can do differently, what your lifestyle is. I asked Gina to sit and tell me all these things that happened during the visit. At what point did she shut down, is what I was getting to. And she said, it wasn't until he said, I can lose my kidneys and I wouldn't be able to work probably at some point in time if it continued to get worse. So I asked her, how did that make you feel? Did you explain to your provider how that made you feel? And she said, no, I didn't think he wanted to hear it. And at that point, I said, wow, Jana is probably like many patients that I've taken care of over the course of the years in nursing, that they just feel that we don't care as providers. And I want to change that thinking. I want to change that environment of not caring. It's not how we feel. We care. Some of us care more than we like to show. And we want to do so much for our patients, but it gets difficult at times. So I want to try to I asked Jana, all right? I asked when I will lose my kidney function, and she said it will happen over some time. Before, this is Jana, my apologies. Before I could ask more questions, my provider says, we're going to take more labs and schedule follow-up in a few weeks, and you can answer any more questions that you have at this point. Jana at this point had no more questions. She began to say, oh my goodness, I'm so done with all of this healthcare. I'm overwhelmed, okay? She's overwhelmed. At this point, her wall is completely up. She's shut down. Jana continues the patient care provider relationship, but she knows that her next visit, that she needs to be better. She needs to ask better questions, and she needs to provide, have a better conversation with her provider. So with that, Jana prepared herself for her next visit. She did her research. She found out what it is exactly, the polycystic kidney disease. She found that it was genetic and that it can lead to some liver damage as well. So she came back and she was prepared with more questions for her doctor, a possible treatment plan. She had her life laid out for him, so he knows what it is that she does on a day-to-day basis, so that when it came time to discuss treatment, her life situation can be taken into consideration so that she can maintain her normal day-to-day activities, which is hard because that's what we want to do. We want our patients to maintain their everyday life activities. We try not to disrupt their life as much as possible. So what happened with Jana? Was Jana present during the conversation? Did the physician or NP recognize the look of despair that Jana had? Did Jana ask any questions? How can Jana prepare for her next visit and future visits? My question to Jana was, does your physician know you? I know that's a strange question, but does your physician know you? Does he understand how much you work out a week? Does he understand that you play tennis twice a week, that you eat out 5 days a week? Those kind of things. Does he know your life? Does he know you and your husband plan trips and go overseas once a year? And she says, well, does he need to know that? Well, not up front, but at some point he needs to understand your life habits so that as life goes on and as the disease process progresses, you need to know how your treatment plan will fit in that so that you don't have a disruption in treatment. So I said, does your provider know your name? Besides your being Jana Constantine and your date of birth, does he know anything about you, who you are? All right, you're not just an illness, you're a person. So when we talk about care, we talk about holistic care, the whole person. And that's what we're trying to get back to. And I love to see our providers who do that. It warms my heart, and I'm so happy to see that it's coming back to that, because we have to treat the patient as a whole. It does not just stop at the disease process, especially with chronic illness. We deal with the patients and we deal with our patients' families. So with Jana, here she went back for a follow-up. She said, I did have a follow-up, and I asked my doctor if I can ask him a few questions. I was able to talk about my blood pressure and my other medications. I also was able to ask about if I had any restrictions at any time of any kind. At this time, he was more apt to be more engaged in the conversation, and it made me feel better. So Jana was persistent. She opened the door to communicate with her provider. The doors of communication were now open because she was more receptive to what the provider had to say. Once that wall went up, Jana had no clue what the provider was talking about. But once she was open and was ready to hear, it was like a flood of information came out of both ends, from Jana being the patient and also from the provider. It was such a great give and take that Jana came out of the visit and she was much happier with the patient provider interactions that they had. He answered her questions. She was able to talk to him on a one-to-one level about what it is that she does in her lifestyle, how she gets on her day-to-day at work, and how this disease process will progress, and what her prognosis will be, and what her treatment plans are. So she was elated that this was to happen. Now with Jana, this ended very well, but unfortunately, I've seen a lot of patient provider relationships not in such a high note. And those are the ones that concern me, because those are the patients that end up back in the hospital because they're not following the directions, because they say, well, my doctor didn't, my doctor knows I work, so why didn't he put my treatment on a day where I wasn't working or where I can take my days off? And then as the nurse or the nurse practitioner or whoever the provider is we say, okay, but did you tell your provider? Did you share this information? How is the provider supposed to know what works for you and what doesn't work for you? And that's where I wanted to have this, want to see some changes. I would love to see some changes. Our give and take in our communication. So with Jana, we went through her diagnosis, as this is how most appointments, if not all appointments, generally go. We go through a diagnosis. You've been diagnosed, okay? We go through the pathophysiology, the ins and outs of the disease process, what to expect, where does it generate from, the etiology, your prognosis, what's the end all, what's going to happen? And then we end up with a treatment plan. Okay, so now what is our treatment plan? What are we going to do? What do we as a provider expect from you? When visiting your provider, they will more than likely sit and discuss all of these topics with you. Okay, when Jana heard, all she heard was the prognosis, that she would probably end up having kidney failure at some point in time. She didn't hear about how the disease worked or what she can do to keep herself healthy. She shut down right at the prognosis. And that's where most of us as patients stop listening. Once we hear something that we don't like or that doesn't agree with us, we stop listening. And that goes with all conversations. I think most of us do it with our family members, our husbands. Husband says something that we don't like, we just shut down, we don't talk anymore. So think about it in that light as well. Our patients do the same thing. We say something they don't like, and they say, you know what, you're not the provider for me because you're not listening to me. And we can be listening, but The wall went up. So how do we keep this wall from going up? We educate, patient education. You know the disease. We teach our patients, yes, we know what to expect, but we want you to know what to expect. So we send you home to do a little homework. All right, so you go home, read about, know what the disease is, what the process, go home and process the information. Sit with your family, share your findings, show them what you've learned, and try to keep it so that everyone understands it. Keep it simple. Can't stress that enough. Keep it simple. The goal is to help you live better, all right? That's the goal, to help you live better and to achieve a journey of health and wellness. And this begins with taking care of yourself and understanding your body and understanding the process of the disease. You are the person living with this condition. Either it's acute or if it's a chronic condition, you're living with it. We don't know how it feels to live your life on a day-to-day basis, having a family, going to work with this disease process. We're here to help you maintain health. And the only way we can do that is if you communicate to us what it is that you need. All right, and this is what us as practitioners consider all of us understanding what the pathophysiology of the disease is. All right, understanding the process, understanding how it works in the body, and we want you to understand the same thing. And by you understanding that, you know what to expect from the disease, and you know how to ask the appropriate questions. We like to use visual aids. Visual aids are very important when trying to learn about a disease process. Half of us leave the doctor's office with a handful of visual aids when we go to our visits. We pick up tons of pamphlets, but do we read them? As patients, do we go home and read this stuff? I know I do, but that's just me. But sometimes a picture of a diagram can speak volumes on what you don't understand. So when you see the picture of your kidneys and the damage it causes after having years of uncontrolled hypertension or uncontrolled diabetes, and what a healthy kidney should look like, it speaks volumes. It's like it's right there at that point. And there's no going back on that, because it's like, wow, if I don't take care of my blood pressure, if I don't take my medication the way I'm supposed to, this is what's going to end up happening. And sometimes this is what we need to see to have that wake-up call for us as patients. So this often can also help with our patients who are struggling understanding what it is that we're trying to say. I've drawn pictures on bed sheets to help patients understand what's going on and give them a visual aid of, if I don't have anything handy, to explain the ins and outs of either the kidney failure or their blood pressure. Show them an accurate way how to assess their blood pressure when they're at home. Let them know they can't put their blood, the cuff, have a large cuff if their arm is small, because the blood pressure reading is going to be different. And then they won't get an accurate reading. So these things are important. If you're telling your patients to go home and they're on a fluid restriction and they can only have 500 milliliters, I know that's a stretch, but just 500 milliliters. I've taught patients to say, okay, use your measuring cup. Put in 500 milliliters of water in that measuring cup, the largest measuring cup you have. You may need to use one or two if you only have a 2-cup measuring cup. And that is how much water you're limited to, for breakfast, for lunch, for dinner. Once that's done, you can't have any more. Sometimes you need to make it that simple so that they understand. Otherwise, they're going to keep going and say, oh, well, I didn't meet that. I had enough. I can have some more. Or I only had coffee. But when you have coffee, take the water out that pitcher and use that water for your coffee. That way you know you still have just this amount left to drink for the day or for that afternoon. That is the important piece. It's when you can see it. Because when someone says you're limited to 500 milliliters of fluid, we're devastated. It's like, I can't have coffee, I can't have tea, I can't have this. It's like, no, you can still have it, but it's part of what you're limited to. So try to keep it in perspective for them and then help them meet you in the middle. Because that's what it's all about. It's about meeting the patient in the middle and meeting them on their terms. So back to Jana. She explained, I met back with her, and she told me that her experience continues to be great with her provider, which I'm very happy to hear. She had some questions, and he was able to get back to her in 24 to 48 hours, and then being able to communicate with her, help her get a better understanding on her disease and what to expect in the disease process. So with that, she was able to go home, process it. It prompted her to talk to her family about their family history, and she learned that her grandmother had the same issue, and that it stems from there, so it's hereditary. She's learned to advocate more for herself, not only in the provider's office, but also in life. So these tips and tools to communicate are not just for healthcare, but also for life. So take it and continue to build on it. That's the most important piece. So with Jana, she continues to see her provider. Like I said, the nephrologist and her are on good terms. And she also sees a cardiologist. And one of the biggest things with that I wanted to share is that with the cardiologist, you have to make sure that everyone is on the same page. And unfortunately, the two don't meet sometimes, so you have to make sure that you communicate anytime you have any changes to both your providers. When we introduce ourselves to our providers, we just start with our name. Hello, my name is. That's so wonderful. Introduce yourself to not only the provider, but to the staff. I love talking to the staff every time I'm a new patient somewhere, because the staff is who you see on a daily basis. Yes, you have your provider, but interact with your staff, because what happens is if something happens to you and there's a change or a decline in your health, the staff knows your baseline. They know how bubbly Mr. Jones is when he comes in the office, and now he comes in and he's just sitting there. They can tell something is wrong, even if when you haven't even met with the provider as yet. Ask questions about your provider. You know, it's so much we give of ourselves as a patient. Ask your provider about himself. They like to talk about themselves as well. So ask your provider, what does he like to do? Keep it simple. Don't ask about personal things. That's not what I'm talking about. What I'm talking about is open communication with your provider. Always be receptive and be yourself. It's so often that we find that, you know, we try to be something other than we're not, because we get intimidated again by the providers and the nurses. And own who you are. Be proud. We always begin our relationships with some sort of introduction. So introduce the true you. During these introductions, you begin to decide if you like your provider, if the provider is right for you, and will you be comfortable asking him personal questions about your life. And these are things that you need to be able to do, because we need to make sure your treatment fits you. And if you can't be honest with your provider, I mean, who can you be honest with? Let's see, the majority of our relationships between physicians and patients begin when we're ill, unfortunately, for the most part. So our first visit may not go very well because you're not feeling very well. And you have to remember that. So you want to be comfortable and build a good rapport. So if your first visit doesn't go well, give it another chance and go into your next visit feeling better and interact with your provider and see if he or she is still the one for you. To know me, to treat me, you have to know me. It goes back to meeting your provider and letting your provider know who you are. We deal with veterans, we deal with the disabled, we deal with the elderly, LGBTQ community. It's so important to be comfortable with your provider. Your provider has to know the real you. When I am with my students and I teach about ethics, and we go over the LGBTQ community, which is one of our biggest communities that have healthcare disparities, as well as along with our veterans. I go in because they just are scared to tell their providers and talk to their providers about who they are. And when you have chronic kidney disease and you're living alone or with family, you need to be able to share this and bring your family in with you. And if you can't share yourself with your provider, how is he going to effectively provide a good treatment plan for you? Speak up, ask questions, bring notes, bring your family, family member, a friend, whoever. You want someone with you to share this information, because that person could pick up something the provider said that you may have missed. Don't be afraid to voice any opinions that you may have. Just be respectful. As patients, I know it's hard to live with the disease process that we have, but we have to maintain that level of respect. Be assertive. Ask questions about your medication. If you don't understand, don't walk away from the table not understanding fully what it is that is expected of you as a patient. That's the most important piece. Tell your doctors if you're using any herbal supplements, as hard as it is for us to get this information from patients, but make sure you tell your provider if you are using any recreational drugs, because this can impact your treatment plan. Communicate. Keep the doors of communication open. Communicate what you want, communicate what you need with your provider, what will help you be more adherent to medication administration or your treatment plan. Explain any differences that you may have, any treatment issues that you may have. If for some reason you can't make that treatment date or it doesn't work for you, you have a trip plan, let your provider know so that we can try to rearrange things. Sometimes we can, but be prepared to hear that maybe we may not be able to. One thing I'd like to give you to take away with communication is have mindful communication. This is something that I learned during a mindful journey that I've been taken on my own lately, and it's very important that you understand when it is that you have these closed off communication issues that plague us in the patient-provider communication. One thing that I've learned is about the red light, yellow light, and green light stages. Red light was when Jana shut down. She didn't hear anything past kidney disease. She was at the red light. She put the brakes on. Right? Yellow light is that in-between stage where I think I'm listening, I'm not sure, I hear a few words, but I don't know. And then we have our green light. Green light is we're open, the conversation is going back and forth, everyone's asking the appropriate questions, and we're getting all our needs met. When we're in the red light stage, communication is cut off. The person is not receptive. So when we see that, providers, we have to kind of look at our patients and engage, and we can see that look of, that blank look. look of despair is what I call it. And the patient is not responding. Sometimes we even get some defensive conversation going back and forth, and then that's when we know that we're at that shutdown period. Our yellow light is that in between, whereas in between communication where they don't understand, and we can clarify any information at that point. So when we see that look, we look at the facial expression, the patient's body language, and we can say, okay, I see that you kind of understand what I'm saying. Where did I lose you? And then let the patient explain what it is that they got from what the treatment plan is or what the medication adherence is, and then go from there. And of course, our favorite is open communication. We all love when our communication is open, when the channels are flowing, everyone is exchanging information, the conversation is respectful, the body language is positive, and we can see that everyone is on board. When we get to that stage, that's when we can progress with treatment plan and lead to better horizons and better health. These red light, green light, yellow light stages are not just for provider-patient communication, but we can use this in life, in workplace, and just general conversations as well, because we don't realize how much we shut down when we hear things that we don't want to acknowledge. So in conclusion, I want to empower our patients. This is what this was about, to empower you. You have more power than you think, and your voice is loud and strong. It will be difficult to start, but it is beautiful when it continues when we keep those lines of communication open. It gets easier with each visit to your provider, so if the first 1 to 2 visits do not go well, please don't give up there. Keep those communications going. And if at some point, of course, if you know that it really isn't going to work for you, find a provider that works for you, because at the end of the day, it's about your wellness, your health, your being adherent to treatment and getting better and getting out there and living life. Let's see. You want someone who's going to listen to you and hear your voice. That's always the most important piece. And as providers, we are here, we're open, we're waiting for you to bring on the questions. The other thing I want to share before we go, as patients, we want you to bring family with you, but also if you don't have family, I didn't mention this, if you don't have family to bring with you, ask if you can record the conversation with your provider. That way you can take that information back to your loved one that wasn't able to be with you, and you guys can develop a plan and develop questions for your next visit. That's part of empowering you as a patient. So I hope this was helpful. I hope these are a few guidelines that you could take back with your provider to help increase communication. We welcome questions from you as a patient about medication, about your treatment, about your disease process, and how you yourself can be a better advocate for yourself and be adherent to treatment and maintain health and wellness. Thank you.
Thank you, Diana, for joining us and leading such an excellent webinar. As a reminder, the slides that were used during the presentation today will be posted to our website once the recording is made available. Check back at kidneyfund.org webinars for this information posted within the week. At this time, I have a few questions that we have received over the course of a webinar. One question that was asked, sounds like it's from a patient, but a person diagnosed with CKD stage 3 was not informed by their provider until the disease was far along. They're wondering, why don't medical professionals tell patients right away when they find lab tests indicating lower kidney function?
What tends to happen, and this is how a lot of our patients end up to us at the hospital, is that our patients are not asking the right questions sometimes. And that's not to throw it back at the patient, but as a provider, again, it goes back to time, one of those barriers, they have limited time. So somewhere along the line, it was missed in the communication on what was going on with lab values and kidney shutdown. With that, if the patient had any indication that the provider did not fully provide the information on what was going on, then that was the time for that patient to say, hey, I think something else is going on. I'm going to find me another provider because something was missed somewhere. So with that, you can do that. You're well in the realm of your right to change providers in the middle of care. You can do that if you feel that your provider is not meeting your needs, because at the end of the day, it's about your health.
Okay. So here's another one. How can I make sure, okay, so it starts off, sorry about that. As a kidney patient, I have several different conditions and different doctors. How can I make sure all my doctors are in touch with each other about my overall care?
That one is a tough one, and that's the one we battle all the time. So what I tell my patients is every time you see your provider, a different provider, you write down any changes and let them know immediately, because unfortunately they do not communicate with each other. So every time you see your cardiologist, the cardiologist is not immediately contacting the nephrologist to let them know you were in the office. Unfortunately, that would be an ideal thing to have in healthcare, but it's not. So it goes back to you communicating to your provider, okay, I just saw, Dr. Cheney. Dr. Cheney gave me this medication, which is different from the last one we were on. I want to make you aware so that we can make those changes in your chart. And unfortunately, if you have many providers, you do have to make that call a few times to make a note of it.
Okay, I think I have time for one more. Sometimes I don't think of questions until right after my doctor's visit. Can I email or call my doctor, or do I have to wait until my next appointment to ask my questions?
Typically, you can call and leave a message. Sometimes they have a nurse or a medical assistant that takes messages for them. If you have a question after you leave, which is so common, just call their office and ask the question to the receptionist or the nurse, and then they'll have the provider get back to you, or the nurse will get back to you with an answer. Unless they have, it's the VA system. The VA system has a system that you can email your provider the question.
Okay. Well, it looks like we're almost out of time, so that had to be our last question. But thank you again, Diana. This was a great webinar, and we really appreciate all of the information that you shared with our audience today. Our next webinar will be held Thursday, February 22nd from 1 to 2 p.m. Eastern Time. Dr. Michael Heng from the University of Michigan will discuss the importance of managing sodium and fluid intake for kidney patients as it relates to heart health. Registration is now available. Visit kidneyfund.org/webinars for more information and to register. When the webinar closes, please do not close your browser window. You may see a pop-up saying that the webinar has ended. Please close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us make our webinar program the best that it can be. Thank you so much. Bye-bye.